Hello, and thank you for being here. My name is Dr. Inayat Ullah. I'm a board certified psychiatrist and an AASECT-Certified sex therapist based in New York. In today's vlog, I want to speak to you directly and honestly about a topic that generates a lot of curiosity, fear, and misinformation: water birth, specifically giving birth in a bathtub. This is a long-form conversation. I'm not rushing through this because childbirth is not something that should ever be rushed, not in hospitals and not in discussions like this. Everything I'm sharing today comes from my clinical work with women and couples, from interdisciplinary collaboration with obstetric and midwifery professionals, and from years of listening to how birth experiences shape mental health, relationships, sexuality, and a woman's sense of self. I'm not here to tell you what kind of birth you should choose. I'm here to help you think clearly, calmly, and safely. Before we continue, you're watching our channel, Imarkami. If you're new here, I invite you to subscribe to the channel. If you find this vlog helpful, please like it, share it with others who may benefit, and don't forget to press the bell icon so you're notified when we upload new content. And if you'd like to connect with me or my team, you can reach us through our official website or our Facebook page. Our professional team is always available to support you with care, respect, and confidentiality. Now, let's begin this important conversation. In medicine, childbirth is often reduced to numbers, dilation, contraction timing, fetal heart rate. Those things matter, but they are not the whole story. From a psychiatric perspective, childbirth is one of the most intense psychological experiences in a woman's life. It activates fear systems, attachment systems, and survival instincts all at once. Many women I see years later are not distressed because of pain. They are distressed because they felt powerless, ignored, rushed, or violated. So when we talk about water birth, we are really talking about something deeper: how environment affects the nervous system, how safety affects pain, and how respect affects long-term mental health. Defining water birth clearly and honestly. Let's be precise. Water birth means laboring and sometimes delivering while immersed in warm water, usually in a medical-grade bathtub or birthing tub. There are two distinct practices. One is using water during labor and exiting the tub for delivery. The other is remaining in the water for both labor and delivery. These are not the same clinically, and any ethical provider will explain the difference. Warm water affects the body through buoyancy and through the nervous system. It reduces gravitational pressure, relaxes muscles, and activates the parasympathetic nervous system, the part responsible for calm and regulation. Fear tightens the body. Relaxation allows labor to progress. The role of the nervous system in labor. Labor is not just uterine contractions, it is a brain-driven process. When a woman feels unsafe, her body releases stress hormones like adrenaline. These hormones can slow or stall labor. When a woman feels safe, oxytocin, the hormone of bonding and contraction, flows more freely. Warm water sends a powerful signal of safety to the brain. This is why many women feel calmer and more in control in water. This does not mean water birth is painless. It means pain is experienced differently. Why women consider water birth? Women who consider water birth often say things like, I want to trust my body, I want fewer interventions, I don't want to feel trapped. Water allows movement, privacy, and a sense of containment. This choice is often made after previous difficult birth experiences or after careful education. Pain, fear, and meaning. Pain is never just physical. The brain interprets pain based on fear, expectation, and context. Two women can experience the same contraction very differently. Water does not eliminate pain, but it often reduces panic, and when panic decreases, coping improves. This is a critical distinction. Physical benefits of water immersion. Clinically observed benefits of water immersion may include muscle relaxation, reduced joint and back pressure, improved circulation, increased mobility. Movement matters in labor. A woman who can move can often cope better. Psychological and emotional benefits. Benefit from my field, the psychological benefits are just as important. Feeling respected during birth reduces the risk of long-term emotional distress. A calm birth environment can support bonding, confidence, and postpartum adjustment. However, expectations must remain flexible. No birth method guarantees a specific outcome. Let's talk seriously about risks. A water birth is not appropriate for every pregnancy. High risk conditions, infections, fetal distress, excessive bleeding, these change the safety equation immediately. Risks may include infection if hygiene is poor, delayed emergency response, or complications during delivery. Safety depends entirely on screening, training, and preparedness. A common concern is the baby's safety. When managed correctly, newborn reflexes prevent breathing underwater. The baby is brought to the surface immediately and placed skin to skin. This requires skill and experience. This is not something to attempt without trained professionals. The baby's transition into the world, postpartum mental health, and birth memory. The memory birth experience leaves a psychological imprint. Positive experiences are associated with lower rates of postpartum depression and anxiety. Traumatic experiences increase risk for mood disorders and sexual difficulties. This is why birth planning should always include emotional preparation, partners, families, and cultural expectations. Partners often underestimate their influence. Emotional support is not about control, it is about presence. Cultural pressure to endure silently increases trauma risk. Supportive presence protects mental health. Water birth is not a trend, and it is not a test of strength. It is simply one option among many. The true goal of childbirth is safety, dignity, and psychological well-being. If water birth aligns with your medical condition and your emotional needs, it can be a meaningful and positive experience. And if it does not, that does not mean failure in any sense. Thank you for staying with me throughout this long and important conversation. These discussions matter because women's mental health truly matters. I will be coming back very soon with a new vlog where we'll continue discussing women's mental health, relationships, sexuality, and family well-being in depth. You're watching Imahakmai. If you haven't subscribed yet, please subscribe to the channel, like this video, share it with others who may benefit, and press the bell icon so you don't miss upcoming content. If you would like to explore these topics further, you can also read my detailed articles on our official website, where I share extended clinical insights and educational resources. And if you wish to connect with me or my team directly, you can reach us through our official website or our Facebook page. Our professional team is always available to support you with care, confidentiality, and respect. Thank you once again for your time, your trust, and your attention. I look forward to seeing you again very soon with a new vlog.